Hi, my name is Melissa Strege, and I'm a physician assistant practicing at Anne Arundel Medical Center pre-anesthesia testing. I have been taking care of surgical patients for 14 years now, and I certainly know that stress around surgery is entirely normal and very common, but I also know that we have many resources available to help reduce this stress during this time. I've also had my own personal experiences as a patient undergoing surgery and anesthesia. And so I do understand that anxious and vulnerable feeling that people have going into a procedure. But I also know that I came out on the other side stronger. And I do enjoy helping people. And that has led me to help create this presentation for you.
Hi, I'm Jennifer Butler. I've been an occupational therapist for 21 years, and I've been helping patients with anxiety and around surgery and hospitalization using mindfulness techniques.
Hello, I am Dr. Rachel Strass, a doctor of Oriental medicine, and I have been practicing acupuncture and Oriental medicine for over 17 years. I specialize in working with people on anxiety and emotional concerns, as well as everything else.
So here's a list of our objectives today and what we're going to talk about, including how to reduce anxiety, especially around surgery, using techniques such as mindfulness, breath work, acupressure points. We'll talk about the 4 pillars of health, and we'll give you tips for home use, how you can use these things on your own at home before surgery, even on the day of surgery, and also after surgery. So we'll discuss mindfulness, how and why we should practice it, as well as where we can learn more about these topics.
So anxiety is an emotion that we usually talk about feeling in our body. You might say your hands are clammy, you might get hot, or your heart is racing, but typically it starts in our mind. So we're going to talk a little bit about our mind and how it works. I found knowing how the mind works, just knowing a few fundamentals, can really help understand anxiety and help us cope with it when we're going to teach you these techniques. So our first, little fundamental tip here is our minds are made to wander. So we may ask you during some of these tools to kind of concentrate or focus your attention, and just know that it's very normal that your mind's going to wander from place to place. But our minds cannot multitask as much as we think we do a great job. We cannot think about 2 things at one time. We can go back and forth very quickly, but really we can only think about one thing at a time. Our minds can be repetitive, so that's a good thing to note when you're kind of taking, thinking about your thoughts. What kind of thoughts are you thinking over and over again? Just to kind of take note of them. And our minds are made to be negative. That's just for our survival, where we kind of always scan our environments, just to make sure we're protecting ourselves. So, we have this negative tilt to our mind, but the good thing is we can kind of think about our thinking, think what actually our thoughts are, and you can alter that relationship with your thoughts. It's kind of nice to watch where your attention is being focused and kind of what emotions are coming along with that attention and where your thoughts are. So let's give a few names to mind habits. I always say if you can name it, you can tame it. So if you're having those negative thoughts, maybe you can just say, oh, hey, my mind's doing this. These will, make sense to you guys. The first one is your mind can be on autopilot. That's brushing your teeth, driving a car, putting a passcode in your phone. We like to plan. We can plan a budget, a vacation. You're planning your surgery, which, can be quite involved. We fantasize about things, maybe, that end of the week, end of the day, vacation. Maybe you're really looking forward to recovery after your surgery. We remember things. We remember 5 minutes ago, 5 years ago. We also analyze. So this is, figuring out things. Our brains are quite remarkable. So you've been hearing what your doctors have been telling you and scheduling things, analyzing all the information you've been giving. Our minds will judge throughout our day, decide, are things going well, are things not going well, kind of navigate our day. But our minds are going to do all these habits, and we're going to have a negative tilt to all of them. But the big one here is the storytelling. So as you're going through your day, having your mind, kind of run through these habits, your mind's going to start creating the story about your day. And this is really where you can kind of change things. I always try to give the example, if you're walking down the hallway or, you're in a store, you might wave or acknowledge someone that and maybe they don't acknowledge you back. They don't smile, they don't wave, they don't say hi. And your mind can go in a lot of different places, Maybe you think, oh gosh, what did I do? Are they mad at me? Is that why they didn't say hi? You could think, oh gosh, aren't they a jerk? They can't even say hi to me. Or maybe, you have compassion. You're like, wow, I wonder what's going on with them. That's not like them. So one little fact, like you pass somebody in the hallway and they don't acknowledge you, and your mind's going to tell you all these stories. So I find that can be really important to recognize your story, kind of recognize your thoughts. What is the habits that your mind's telling you? Do you have that negative bent to it? And really focus where your attention is going these days, and kind of what emotions is that bringing up for you. Just having knowledge that these are things that your mind does and it's normal, I found very helpful to cope with anxiety. So here's the beauty, here's the moral of the story. You don't have to believe everything that you think. So you're gonna have thoughts, but no matter what happens on the outside of us, we always get to choose the story that we tell ourselves.
So this slide really sums it up for me. How are your minds altering your emotions and your experiences? Are you completely lost in thought with all these thoughts jumbled around in your head? Or are you being mindful and just in the here and now and just noticing, being present of what's right here in front of you? So we all have the option to choose. So if you haven't already guessed, the first tool in our toolbox is mindfulness. So what is mindfulness? It's paying attention in a particular way on purpose in this present moment and without judgment. So medical journals and scientific studies support the benefits of mindfulness. And, we just need to be here and now and not judge those thoughts that we're having. It's okay to recognize them and, even name it, but without judgment is the hard part a lot of times.
And mindfulness, if this isn't a term you're familiar with, you wonder, have I ever had a mindful moment? I can reassure you, you have. I'm going to give you some examples and that maybe you'll better relate to, so you kind of know what we're talking about when we're asking you to be present and have a mindful moment. So if you've ever sat in a quiet place to have a moment, for me, I always say, maybe I open the front door on a fall day and the warm sun hits you and you just you just melt. There's nothing else that matters. Maybe you've taken a breath or a moment before talking, really mindfully thought about what you want to say or respond to a person. It can even be something fun, like you really tasted your food or a drink. You might be going along a meal and you take a bite, you're like, oh, wow. And it really catches your attention, right? So you're not thinking about the past, you're not thinking about the present, you're just really enjoying the present moment and the sensations that you're having with a good bite of food. So I hope that helps you wrap your head around mindfulness. It's not something, crazy or foreign. You've definitely had a mindful moment. So mindfulness, like Melissa said, in research, it is really got traction behind it now that it can help us. So sometimes though, it's hard to say, oh, I'm going to be mindful right now. So this acronym can be very helpful. Stop. So the first one is stop what you're doing. So you just kind of take that acknowledgement that you need to pause. So stop what you're doing. You take a deep breath. Your breath is always with you. So that's always a good place to start, is you're kind of centering your mind to your body. And then observe what's happening with you in this moment. So you're not going to think about what just happened 5 minutes ago. You're not going to think about the future. What kind of sensations does your body have? What kind of thoughts are going on in your mind? What emotions are attached? Just acknowledge them. Nothing is right or wrong. You're just acknowledging what your body feels like, what your mind feels like. And then proceed with what you're doing. So it's just a nice tool so it doesn't seem so foreign and helps you just take a check-in with the present moment.
So let's talk about the stress response for a minute. It's also known as fight or flight, and it's entirely normal for survival, just like Jen was saying. We've evolved this way. So what happens when we experience stress in the body? Sometimes we feel our breathing increase, our heart rate can become rapid, our blood pressure goes up. Sometimes our palms feel sweaty, or our muscles can feel tense and tight. So we can acknowledge these signals in our body, and we can use those as a reminder to practice mindfulness. When you start getting that anxious, nervous feeling and you feel that stress response, and you can use that signal and remind yourself to do the stop technique that Jen was just teaching us. So it's important to listen to what your body is telling you. As we become aware of the present moment, we can slow our breathing. This can help to lower our blood pressure and our heart rate, and it can decrease that feeling of stress. And these are some of the reasons why we should practice. We evolved this way for our survival, but we are not meant to stay in the stress response and the fight or flight response all of the time. Your body gives you these signals and you're supposed to, respond temporarily and suddenly when, there's something going on. But sometimes when it becomes prolonged, that's when we need to recognize and take the time to practice. So practicing can help decrease pain and stress, anxiety, depression. There's research that shows that it can help our sleep and help us to think clearer. I had mentioned about improving your heart rate and blood pressure. We all know that feeling when we go to the doctor and our blood pressure's high and we say, oh, it's just because I'm anxious today, check it again and I'll see if the blood pressure comes down. So there's lots of evidence also that it can even improve your immune function, practicing these techniques, and overall can improve, our life satisfaction and, not feeling that anxious stress response all of the time. So I really like this quote, and I think it's a great reminder. As long as you are breathing, there is more right with you than wrong with you. Breath is life. And this is a quote by John Kabat-Zinn. He is considered a teacher and founder of the mindfulness-based stress reduction program. He's written many books on this topic. He has a program that helps people, to identify the stress response and, work with meditation and mindfulness practices. These are all supported by scientific studies and medical research. And our breathing is one of the first ways that we can practice mindfulness. I really thought this quote was a good reminder because there's always something we can point out and say, oh, this is wrong with me or that is wrong with me. But truly the body is miraculous. And if you are breathing, there really is more right with you than wrong with you. There's so many things that our body does that we really sometimes just take for granted. So just remember, this is good thing to remind yourself of. So next, we get to have Dr. Strass talk to us more about breathing.
Okay, thank you, Melissa. Breath work. Yes, the breath is so important. I mean, it's the one thing that we do constantly for our entire lives. You think about it, the first thing we do when we're born is inhale and take in oxygen from the air. And we start breathing. And then we continue to do that our entire lives until the last breath leaves our body at the end of our life. There's nothing else. I mean, the heart is beating, but we don't really have control over that. But we do have control over our breathing much more easily. Breath work is thousands of years old. Makes sense. Just think about, what does a pet look like when they're taking a nap, or a baby? When they're lying there, their belly is going up and down, up and down. It's not just their chest. A lot of people, once they learn this habit to not breathe with their belly, and you don't get as much oxygen in that way. So belly breathing is what we call this. And it basically is using the diaphragm muscles underneath the rib cage to expand as we breathe in. And the simplest way to do that is just imagine that as you inhale, you are trying to stretch your waistband of your pants or whatever you're wearing around your waist, trying to expand that, push against that waistband. And just try it for a minute here. Let's inhale. Imagine that your belly is pressing up against your waistband, and exhale, letting it relax, come back in. Or you can imagine if you were lying down, as you breathe in, you're trying to raise up your stomach to the ceiling, or pretend that you have the Santa Claus belly, just trying to push that out, right? As you inhale, sticking that belly out. As you exhale, letting it come back in. So whenever you're nervous or anxious, you can use this tool to calm your body down. That's belly breathing. Next thing I'm going to talk about is 4 square breathing. So basically, you're going to use the technique of belly breathing, and you're going to time your inhale, your hold, your exhale. So as you inhale, you're going to count to 4. As you hold it for 4 counts after inhaling, and then exhale for 4 counts, and then hold it for 4 counts. So let's try that. So inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4. Inhale, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. Hold, 2, 3, 4. This is the type of thing you can do anywhere. You can do this when you're sitting at a red light in traffic. You can do this when you're sitting in a meeting, listening to other people talk. It's always available to you. And it's a wonderful, quick way to calm the body, calm the mind, focus on the here and now. So let's talk about acupuncture. Acupuncture is very powerful, and it's a tool you can use before and after surgery. Many scientific studies have confirmed its anti-inflammatory effects as well as its calming effects, and great for pain, great for all kinds of things. We got faster healing, less pain, lessens the complications and the likelihood of complications, and mitigates the side effects of anesthetics. This can take hours instead of weeks. Some people are sick from anesthetics for quite a long time, but acupuncture can be very helpful with that. A skilled acupuncturist can make your surgery much easier on you and a lot more successful in the long run. So acupressure, let's talk about that. The first thing we do when we hurt ourselves Ouch, you touch the spot that hurts, because touch is healing. Acupressure predates acupuncture, actually, and it really is self-care 101. We all know that this is healing, and it is basic to all mammals. Animals will lick their wounds. Even primates touch each other, try to comfort each other. Touch is the most important thing to any living creature, really. And the thing about acupressure is it's light pressure. You're not digging in deeply into the muscle. You just want to hold the point, find the point somewhere, and you just hold your finger there for 30 seconds, 60 seconds at the most, or until you start to feel a pulsation under your finger. That's all there is to it. Touching with intention is the best thing you can do. You don't have to do it on the skin. You can do it through the clothing. It works just as well. And you can use more than one point at a time. You can combine points, and I'm going to show you that in just a minute. One-sided is fine. You don't have to do a point on both sides. It can be really awkward. Don't worry about that. You just do it on one side, you're fine. It's really very simple. Okay, so let's talk about some points. So first one I'm going to talk about is the earlobe. Very easy. Everybody can just grab your earlobe and pull on it gently, tug on it. People do this all the time without thinking, and because it's soothing. It calms the mind and the body. It's great for anxiety, great for insomnia, spinning thoughts. You can do this when you're talking to somebody. Just pinch your earlobe. They won't even realize that you're doing self-healing. All right, the next one is heart 3. This is on the heart meridian. You can see the picture there. It's inside the elbow on the side, same side as the pinky. If you just trace a line up into the crook of your elbow from your pinky, right there. This is a wonderful point for racing thoughts, inability to fall asleep, especially when you're lying in bed and your mind is spinning. This is a wonderful point. It's great for chest palpitations, calms intense emotions, just kind of brings the volume down on everything. The next one I'm going to talk about is heart 7, right here under the pinky. You just follow the little bump down under the wrist, right into that spot. And this is a wonderful one for anxiety, insomnia, and feeling out of control. This is kind of a remember who you are point. It's a lovely point. One of my all-time favorites. Pericardium 6, you may already know this one from the nausea bracelets that they sell. They're little magnets that go right on this spot. So if you go to the middle of the wrist, right between the two sides into the center, and then pull your finger down, there's a little dip there that you feel. That's pericardium 6. It's great for anxiety, nausea, seasickness. It's great. Car sickness too, actually. The next one is triple burner 5, which is basically on the other side, on the back of the wrist. So just right in the middle. You come to the bone and just come down. You should feel a little dip right there. This is great for heat flushes from anxiety. If you're sweating, got sweaty palms, you're just freaking out from a situation, worried about your upcoming surgery. It's a good one. It's good for an upset stomach. And it's also great to combine it. So you can just take your thumb and forefinger, put your thumb on pericardium 6 and your forefinger on triple heater 5. And this is a wonderful point combination for all kinds of just anxieties, worries, just not feeling good, not feeling right. This is a great combination. Stomach ache, this is a great one. And we do it automatically. A lot of these, we just do them automatically. You're thinking, put your finger up here. It's the spot that you go to. And you can do both sides if you want or not, but it's good for headache. It's good for mind spinning without coming to a conclusion, just repeating this obsessive kind of thinking and negative thoughts. And of course, you don't have to do both sides. You can just do one side or the other. It's a great point. Another one, another great point, yin tang. Good for mind fog. It's right between the eyebrows. A lot where people think say the third eye is. It's right there. It's good for mind fog, headache, calming the mind, focusing the mind. I feel calmer already. Okay. All right, and now I'm going to turn it back to Melissa, who's going to talk about.
Thank you for that. I feel calmer too.
Okay, good.
All right, so the 4 pillars of health. We have been talking a lot about mindset already. There's other pillars too, nutrition, activity, and sleep. And Dr. Strass just gave us some great tips on some points that we can use for that anxious feelings and also even for sleep too. So nutrition, what am I talking about here? I am talking about good quality foods and also hydration. I'm sure the nurses told you that it's very important to be well hydrated before surgery. We all know that dehydration can cause and lead to other medical problems, and we just feel yucky when we're dehydrated. So good quality foods, I am talking about eliminating processed foods, minimizing sugar, and eating real whole foods like fruits and vegetables. So our bodies need nutrients for healing. So we have to think about that when we're, feeding ourselves before surgery and after. You want to give your body the best chance for a good recovery and healing here. So activity. There's lots of activities that people can do even when they're having surgery. I know that some people have injuries and they're limited in what physical activities they can do, but even things as simple as some gentle stretching or even ankle pumps just to get that blood circulating and flowing, and walking can help. It can help improve mood, our health overall, gets blood and oxygen flowing, improves our recovery, and it reduces anxiety and depression risk. Sleep. So your body performs rest and recovery functions when you sleep. You need to sleep to heal. So it's very important. A lot of times when people are recovering from surgery, they feel very tired, and it's actually important to listen to your body and take that time to rest and recover. So during this time when you're trying to heal, it's also really important to minimize alcohol, nicotine, caffeine. All of these things can actually interfere with sleep. They're certainly not good for our health. And really, truly, there's evidence that shows that they can make anxiety worse. Mindset. So we've been talking a lot about mindset, stress management, mindfulness techniques, belly breathing. So a lot of our stress is from stress thinking. A lot of times we are not here in the present moment. We're worried about something in the future that hasn't even happened yet, like what's going to happen on our surgery day. Or we're worried about something that already happened in the past, like, why did I do this? Why did I get myself in the situation where I even need surgery in the first place? Honestly, none of that is going to help us. Come back to the here and now, use our techniques that we've learned to bring us back into this moment and tap into that healing resource. All of these things take practice. They really can't just be done once. You're not just going to sleep once and say, oh, I got one good night of sleep and I'm done sleeping. And you're also not going to say, I just ate one meal and I'm good and I'm not going to eat anymore. So same thing with mindset. It takes practice. Each of these pillars takes practice, just like brushing your teeth. You got to make it a daily habit. At first, it can seem a little overwhelming, and that's understandable. So really, just pick one for now that you may want to focus on and start working with that. Typically, as one starts improving, the others start improving over time. So I know I was talking about nutrition and good quality foods for healing and recovery. A lot of people may not even realize that the foods that we eat are related to triggering anxiety. There's actually a lot of medical studies showing this now, and it's linked to the process of inflammation. So inflammation is the precursor to diseases in the body. And there's lots of links showing its risk to anxiety and depression. So I'm sure everyone can think of a time where they ate something that they know they shouldn't have eaten. They went through that McDonald's drive-through and they got an upset stomach and felt sick, and they said, oh, I shouldn't have eaten that. And that's another important time to listen to your body. It's also okay if you did do that. Don't beat yourself up over it. Move forward and just realize that these things need to be eliminated, minimized, and recognize how your body feels after, avoiding these things or consuming these things. A lot of people get really anxious and jittery and heart racing if they drink too much coffee. So it's important to recognize those things so that we can take better care of ourselves. And minimize the anxious feelings that we're having. There's lots of evidence showing that following an anti-inflammatory diet can improve healing and reduce anxiety. So I'm going to let Jen talk to you about activities since she's our occupational therapist.
So typically after surgery, the activity that's recommended is walking. Always listen to your doctor, and we understand some people might not be able to do this right after surgery, or maybe even it's just a whole process to get to the bathroom. Count those bathroom walks as well. But as the more walking you can do, it really circulates your blood flow and helps a lot with healing. And when you're not walking, ankle pumps, ankle circles, get that blood circulating in the lower body. It can really help the healing process. So at the very minimum, walk, ankle pumps.
So I know for me, I am someone who holds a lot of tension up here in my neck and shoulders. You know, we talked about the stress response. When you feel stressed, you can feel muscle tightness and tension. So sometimes you just need to loosen up that tension. You can do it right now. Just stretch out your neck, stretch it out. A lot of times when I have my patients do this, they say, oh, wow, yeah, that feels better. I do. I feel that tension releasing and letting go. You can do this at any time, really, just kind of loosen it up. You know, you can also kind of move your shoulders and arms. You know, some people say, shake it off, shake it out, just shake those feelings off. Another thing is just, you know, shoulder rolls up and down. I mean, just simple activities I'm talking about. You don't have to run a marathon to say that you're doing some activity. These, you know, stretches and things like that have shown to help reduce that tension and anxiety too. So even people say, you know, they notice if they've been sitting for a long time, they feel like they get stiff and tight. So that's what we're talking about. You don't want to get stiff and tight and tense. Just get up and walk, even if it's a simple short walk to another room, you know, every few hours or so after surgery, just to get that blood flowing and moving. Okay, my circle of control. So many people tell me that, you know, when they're preparing for surgery, just a lot of things don't feel like they're in their control right now. And I definitely recognize that, you know, you didn't want to have this surgery and, you know, it's not in your control, maybe the fact that you need the surgery, but it's still important to remember that there are plenty of things still within our control. And switching our focus to what we can control can sometimes be a really helpful strategy. So focus on what you can control. You can decide to follow your surgeon's rules and instructions and make decisions that are going to be helpful for your recovery, taking care of yourself, and even, you know, recognizing when you are having those stressful feelings or those thoughts that there are things that you can do to, you know, work on that, following all these techniques that we're giving you. So instead of letting things spiral out of control, recognize what you still do have control over and work on using those techniques to bring things back into your control. So I know this next topic doesn't really apply to everyone. Thankfully, I don't see as many people smoke these days, but unfortunately, we still do see tons of, you know, e-cigarettes and vaping and that sort of thing. And it is important to know that if you do need help with this topic, there are tons of resources and help out there. Everyone's situation is different. Everyone needs help in a different way and has different strategies for quitting. But even quitting the day before surgery can help recovery. So there's lots of improvements that happen very quickly after quitting. Even 20 minutes after quitting, your heart rate and blood pressure can improve. 12 hours after quitting, the carbon monoxide levels in your blood drop and your blood oxygen increases. It's certainly very important to have good blood oxygen circulating when you're trying to recover and heal from surgery. So, you know, that's why I'm saying even quitting the day before can actually really improve your recovery. So people, unfortunately, try to convince themselves that smoking calms them down and that it helps them feel less anxious. There's actually a ton of studies that show the opposite of that. Unfortunately, smokers have a lot more anxiety and they do have increased sensations of pain. So really, truly cutting out that nicotine in any form can really actually help your recovery. And we have lots of resources available to help you through that process if you do need help with that. So we have a smoking cessation team here at the hospital that offers many different resources and strategies to help you get through that if that is something you are in need of. So check that out. Another important tip to note is that alcohol can also slow recovery. And unfortunately, it does also have a lot of interactions with certain medications, especially medications that you may be given after surgery. So it can be dangerous in combination with prescriptions. So just be very wary of that and, take it easy. So I just wanted to review some tips for coping with anxiety. We talked about focus on what you can change. We know that not everything is within your control, but there still are plenty of things that are within our control, and we need to just focus on that part of it. Remember the stop and breathe acronym that Jen taught us. And, I actually heard something over the weekend that I really liked. We were talking about Dr. Strass's four-sided breathing, and I heard something when, part of the breathing technique is to breathe in for 4 seconds and then hold your breath for 4. And what I heard over the weekend was when you hold your breath and you stop breathing for those 4 seconds, when you stop your breathing, stop your mind from chattering too. And the process goes hand in hand. And it was a good reminder. So sometimes we need to figure out what's bothering us, listening to our body, what our body's trying to tell us, tuning into those signals, and then using our techniques to help us get through it. And sometimes we just need to focus on something else that's less anxiety provoking, and that's okay too. There's lots of other techniques that you can do too. So bringing yourself back into this present moment. The past is just a memory, and the future is just a mystery and a fantasy. The only thing that's real is what's here right now in front of us. And this is the only moment that we ever have control over, right here, right now.
That was a great reminder, Melissa. We wanted to give you a few resources for mindfulness. The first one here is a book by John Kabat-Zinn, which Melissa mentioned. He's the guru of mindfulness, especially here in the US. It's called The Full Catastrophe Living. You can read one chapter, like you don't have to read it front to back. You can just pick a chapter. It's an interesting book to read. And then we gave you a couple apps that we're familiar with using. Sometimes it's hard for me to just run through a mindfulness moment. So it's nice to have that external stimulus actually talking me through it. It's helped us with falling asleep. It's helped us with taking that breath, easing our breathing, and certainly has helped us, walk through an anxious moment. So the Calm and the Headspace app are two that we can speak to. But there's tons out there, lots of free apps out there. You can always try usually a free version before you purchase anything. And I lived off of free versions for a very long time.
So like we were talking about, plenty of resources available. If you really are in need of mental health services, that is also available here at our hospital. They offer counseling and therapy services. I called them and I talked to them, and they are very grateful to have any, referrals for our patients. So you can certainly call them up yourself and, let them know if you would like to meet with any of their team members. They're available for you. They have a website and their phone number is right there for you.
Okay. Well, what a great set of tools you guys have put together. This has been a lovely presentation. And using these tools that we've given you will make your surgical experience much better. As I mentioned earlier, acupuncture is a powerful tool for pre-op and post-op success. It's a proven anti-inflammatory, It speeds healing, reduces pain, lessens complications, and mitigates the side effects of anesthetics. I've been practicing for over 17 years, helping people regain control of their lives and their health. Mindfulness, good self-care, and asking for help are the cornerstones to living a good life. So for more information on acupuncture, Chinese herbs, and holistic living for support with stress, anxiety, and physical concerns, please feel free to call me for a consultation. I offer in-person as well as telemedicine appointments. Thank you so much for your time and for your attention.
We just want to wrap up a summary of everything we've talked about today. We'll start with the mindfulness, the STOP acronym, changing the story that's going on in your brain, the breathing techniques that Dr. Strass so kindly walked us through, the belly breathing, 4 square breathing, and then those acupressure points. There was a lot of them. She gives you a nice, bullet point of which ones to use when. And then the 4 pillars of health, like Melissa said, just start with one, whether it's your sleep, your nutrition, activity. All these techniques are for, listed above, or for mindfulness or mindset. So just pick one of the 4 pillars of health, stick with it, do them consistently. And we hope that all of these techniques that we've given you, these tools in your toolbox, you can use at home. I think Dr. Strass mentioned most of these you can do just about anywhere at any time, and no one will even know. So we hope that it helps you, days before surgery, right before your surgery, and certainly helps you cope after your surgery. So we just want to thank you for being here. This has certainly been a labor of love for all 3 of us. We've really enjoyed putting this presentation together, and we're just hoping it helps someone at some point in time. I'm certain that we know that it will. So hopefully you're one of the lucky ones, and you've learned something and you're able to put it to use to make everything better for your surgery. So thank you so much for being here.
Thank you both very much. And I just want to let patients know that I am a patient of Dr. Strass, and I have found so many benefits from seeing her and doing these acupressure points myself and having her do acupuncture with me. And I just can't speak enough to how wonderful she is in real life. So thank you again. Of course. Thank you again for being here today with us. And I hope you find this helpful.